Hello and welcome to another episode on Postcall Beyond the White Coat, the podcast that takes you on an unforgettable journey into the lives of doctors. I'm Dr. Selena. Now, if you have not followed our podcast, be sure to hit that follow button to follow our channel. In today's episode, we'll be exploring doctors in alternative careers. And our guest today is Dr. Bhavani, who transitioned into Health Informatics. She's been in Health Informatics for about 16 years now, and that's a very, very long time. Now, currently, she's the head of healthcare informatics at a company where she provides automation for hospital operations and ensures that related data integrity for the purpose of data analytics. Thank you for joining us today, Dr. Bhavani.
Thank you, Dr. Selena. It's my pleasure.
So, Dr. Bhavani, maybe could you just tell us a little bit about your background story, how you went from a medical doctor into what you're doing right now?
Well, I've always wanted to be a medical doctor to start with. Then there was this period of phase in my life where I was not able to pursue what I have always wanted to do, and this is simply because of a very traumatic episode in my life. Then I had to start looking at, other ways of continuing doing, or rather practicing medicine, which I needed the time to basically recuperate due to the traumatic episode. So, therefore, I was looking at all avenues like, being in the pharmaceutical line and also insurance. But digital, or rather the healthcare informatics, was never in my mind. That was something that was an industry that was not something that I was well aware of until I got a call from a friend that, whether I was interested to work in this company, which needs a medical doctor to provide the domain input because they have a software. And to be very honest, even at that point of time, I was clueless what is it all about. So I must say that the transition was made simply because I really wanted to move to a more of a corporate setting so that I was able to deal with the traumatic episode that I was slowly, coming out of it. So that is how I got into this healthcare informatics company. That was about 17 years ago. 2007. Yeah, so it was like 16 years ago. And I went for this interview, and I would like to mention his name because he is also responsible for who I am today. His name is Rolf Henry, a Norwegian, and he actually had a business or company founded by his father in Scandinavia area, where they were into this software hospital information system for all the healthcare facilities over there. So he decided to tap into the Asian market, being Malaysia being the first. So he interviewed me, and I was handed down a brochure just 30 minutes before going in for the interview. So again, I had no idea what was hospital information system all about on healthcare informatics. But I read about it 30 minutes before I went in, and he answered. He actually questioned me how I would be able to contribute, and I said it's definitely going to be my knowledge in the healthcare that would immensely benefit your solution, with all confidence. And he was impressed, and that's how I got in.
Wow, sounds like quite a journey. So you mentioned a traumatic incident. How did that affect your work? I mean, at work, that made you decide that, okay, I cannot continue being a doctor anymore?
It was terrible episode, Dr. Selena, whereby I was not able to, because it's patient care. you need to be focused. You need to have the ability to actually concentrate and come up with good decision support. That is number one. It was mentally tiring, and I was in mental agony to say, and that's that. Number two is that at the same time, I had two two children who were very young. So I found it very difficult to cope being a medical doctor, going through that emotional trauma and mental trauma, and also being a mother to both the kids. So what I was actually longing for was a 9 to 5 kind of a corporate job. So, I thought at least I will have the Saturday, Sunday, or the weekends as a breather, and, able to spend with my time with my children.
Okay. Did you face any stigma when you are, living that, that facade of being a doctor, the doctor that has it all, to, doing something else completely?
Definitely, I did face the stigma. I was ostracized. In other words, because being a doctor is a prestige thing. Typically in an Asian family, right? So coming out of it, of course, I was met with a lot of criticism on leaving the healthcare industry. Then, of course, there is also another stigma that I had to face. When you join the corporate company, it is the people surrounding you, because having a doctor was something very peculiar to the people who were working the company. So there were two types of stigma within the family circle, the relatives and all, the community, to mention it specifically, and also at the workplace.
So how did you deal with it? I guess a lot of young doctors are feeling that, people will say, yeah, you're a doctor, why are you not seeing patient? Sayang na, 5 years study.
True. I would actually attribute the perseverance I had, I would attribute it to my spiritual master. I was given the opportunity to attend this wonderful seminar, which is known as the meditation seminar. So the meditation itself kind of gave me that strength. You need that inner strength to actually remain resilient of your decision. So, of course, without the spiritual master's guidance, I wouldn't have come this far.
Wow, sounds like you had to go through a lot to get to where you are.
It was a very challenging journey all the way, Dr. Selena. Never easy, because I was met with a lot of challenges, obstacles, I would say. Because when you don't have the support, we are constantly met with, questions like, why did you leave? And, that kind of queries coming all the way. And then at the workplace, to be very honest, also I did not have the support, because it's a different group of people, different skill set. So they were not able to accept a doctor working with them. So that was another huge challenge that I had to go through. But again, the inner force that I had, which I got it from, practicing meditation, that gave me all the strength and the steadfastness to, progress.
Okay, so can you tell me a little bit about that stress at work, moving into a completely new place, having a different set of colleagues with different skill set, different mindset. How did you maneuver around that?
First of all, I would have to actually list out the kind of stressors that I had. First, and foremost is, of course, the computers. Okay, maneuvering the computers with MS Word, PowerPoint. That itself was challenging for me. Then number two was that the industry that I was in, the healthcare informatics industry, I had to talk or speak to developers, people with no medical background, but building softwares or designing softwares for doctors to use. So can you imagine someone who has no knowledge in medicine, but they are actually designing a software for doctors? So, when I talked to them, it was like, for them, it is an alien talking to them. That is that. And then, these are the two main things that I had to go through. But what I had within myself is that I was always positive. I tend to look for, there is something good, there is something better. And every day I will wake up saying that today is going to be a better day. With that mindset, I was able to conquer all these, challenges that I just mentioned, especially, the micros, handling the computer. What I did was that my job required a lot of presentations. So I did a lot of work on PowerPoint presentations, tried to, make it as narrative, animated, and of course, impressive as well. So that's where I started winning the race slowly and gradually. And when my target audience, that those were the doctors, healthcare personnel, they were responding to me in a very positive manner. I knew that I've won half the battle.
I guess it's all the small wins that you need to just celebrate, right? To help you go further.
Correct, exactly.
Uh,
It is all about never giving up, Dr. Selena, because, like I said, I had no other option. I had to be in this industry because I couldn't just go back to medicine. So I was here, and then I had two young children. So I had to provide the best for them. And I knew that this is the industry. And I had a great boss, which is Mr. Rolf Henry. He would always, give me that encouragement, motivation, and most importantly, the respect. So that kept me going.
I guess it must be hard because you're working with like engineers and software developers, and how do you get their respect, right?
Yes, because they found me too, because they have already a design that has been designed. But when you try to give them more input, it was actually disrupting their productivity per se. So you are actually disrupting their work, or probably I would say I was their burden. That's how I saw, or that's how they perceived me as. But as time went by, when the developers noticed that the design became better with my input, slowly and gradually, of course, they never applauded me, but the hostility reduced.
Okay, so that was like 16 years ago. I mean, I have been at the receiving end of having to use bad software developed by developers, as a clinician. So that was 16 years ago. What is it like right now? Like fast forward 16 years later, how important is it to have a physician input in all of this?
Definitely, it is beneficial to have a physician input because the way the system is operating, it has to be catered according to the physician, and the end result is the optimal results that you want to give. For one good example that I would say is the able to receive the results, the laboratory results, able to order the various investigations, how that be presented in a layout. And then not only that, the design, in order to get the doctors or the physicians' acceptance to use the system, it has to be user-friendly. So those are the important elements where, we as, or rather I as a clinical domain consultant, was able to give that input to the developers. And of course, the development of more modules, because many software solutions, they have, very bang, they have minimum or requirements to come up with a design. But when you want more, like for instance, if I want to go into CDR, a cytotoxic drug reconstitution ordering, how do you want that design to be incorporated? And for now, medicine is not all about just talking to the patient and just giving medicine. It is a holistic approach. You must have a plan of care, and that plan of care should be designed in the system where it is made available very easily, and accessibility should be there. So this is where the input from the doctors is vital for the evolution of a better software design.
Actually, you are right because at one point I was working in the ICU, and in the ICU we have this huge chart where we chart down all the vital signs. There's like 6 different systems there where we chart the vital signs for the next 24 hours. So if something happens, we can tell exactly what happened at what time and what happened before. We can see like what has happened before, and you can anticipate what's going to happen next. So I remember a software in one of the hospitals I worked at. They decide to computerize that monitoring chart, but instead of they don't know why the chart is there. So what they did is they broke the chart up into 6 or 12 different fragments into so that you see it through the computer. And I remember very clearly when a patient collapsed, we didn't know what happened because it took so long, and it needed everyone to try and match what happened to see the charts, right? To combine that 12 fragments of a chart to see what actually happened. So I guess these are where engineers and developers decide to design something for healthcare without getting input from clinicians.
Correct. I do agree because I have seen systems where the design is flawed to a certain extent. So in the end, it becomes cumbersome. After all, the use of the system is supposed to facilitate your work, but physicians end up, it becomes an added stress for them, not only being able to make the right clinical decision support, but then it becomes an added burden because navigation is so difficult, the visibility, the accessibility to, to the important or the fundamental values are not there.
Yeah, well, that is true. So what do you think is the landscape like for doctors in this field? I mean, after 16 years, you've been in this field for 16 years. How do you see the career prospect of a doctor in this field now?
Definitely, the expertise of a doctor is much needed in this industry, as I see, because especially the the companies that are designing the software, they definitely need a domain expert. I would say a doctor for electronic medical record and various other modules pertaining to the physician care. And then, when it comes to radiology, you need a radiologist. And of course, at the OT, you need the anesthetist. All this background. If you had actually worked in all these various departments or disciplines, your experience would be of immense help to these software companies. But let's not narrow it down to only software companies. Your job as a clinical domain consultant in this industry, healthcare informatics, it's not only curtailed at that area, but you can actually work also at the client side. Meaning to say, you can be also a doctor who could be the person in charge in the hospital overlooking the digitalization of the whole hospital records. So you will be actually responsible for the implementation or the automation of the healthcare system. So your position is not only at the software company, but you can also work in hospitals in order to implement this.
I see. So actually, it's quite a broad scope, correct?
Yes, it is. Many of the, I would say, you start with going in as an application consultant, and you can actually climb up the ladder and reach to a position known as a chief medical informatics officer. This particular position is very, very famous in Europe, in US, in countries in the Western side. Yes, it's very much, they have actually created a role known in the C-suite section itself. So that's how high you can climb.
Wow. Okay. I guess a lot of us wouldn't know about this, so I guess you are the right person to share on all of this.
Yes. So what I'm saying is that healthcare informatics industry, it has actually come to a point where we have a association, just like in Malaysia we have Malaysian Medical Association. We have various associations to take care of the welfare of people personally involved. But just like healthcare informatics, we also have a organization known as HIMSS. So you can go into HIMSS, get your accreditation there, and you just add on value to what you are.
Okay, so how can doctors get into this industry, and what's your advice for all these doctors who want to move out of clinical medicine?
First of all, I would always say that positive thinking is very important. Okay, and the reason that you leave your medical or your healthcare is another factor. If it is all about you have no more interest, then I think it would be easier for you to transition into healthcare informatics because you really don't have the interest. But if you always had the interest to become a medical doctor, but due to circumstances you cannot continue, then it is very important for you to be equipped with positive thinking, because coming to another industry, you need to embrace, whatever that is in store over there. Otherwise, you'll end up being flustered, dejected. So it is no point living. It becomes more of like a job hopping, which is simply a waste of time.
Okay, thanks, Dr. Bhavani. I think your story is very, very inspiring. How you overcame your challenges, and I believe it must be a steep learning curve for you to, learn all this health informatics. So thank you a lot for sharing today.
You're welcome, most welcome, Dr. Selena.
Okay, thank you for tuning in to an episode of Post Call Beyond the White Coat. We hope you enjoyed our discussion with Dr. Bhavani. And don't forget to hit the follow button to stay updated and listen to more inspiring stories of doctors who have made a successful career transition. Thank you for listening, and we'll see you next episode.